everyone. Good morning.
Morning, everyone. Hi, my name is John Maricel Padasas, and I'm also known here as JM. I am one of the infection prevention and control nurse here in Corazon Locsin, Montelibano Memorial Regional Hospital. And together with me today is
My name is Christopher Madanza. I am also one of the Infection Prevention and Control nurse. And this week we are celebrating a National Infection Prevention and Control Week with a theme, IPC Champions, leading the way to safer healthcare. This celebration is from July 7 until July 12, 2025.
Yes, and we do have several activities already prepared for this week. Yesterday, we did have our opening through our flag ceremony, and we also did the health education to our newly opened DOH Wellness at SM Center.
Yes, that's true.
And for the rest of the week, we have still an ongoing photojournalism contest. We have already received, sir, several entries.
Yes. Please do send because we're still open for your photojournalism, and tomorrow maybe we'll be collating all the entries, and on July 11 we'll having our culmination day, and the champion will be announced as well.
Yes, aside from the photojournalism, we also have our IPC champions. So each unit or each department are to choose who are their IPC champion. Who do they think have um, the what do you call that? The great contribution when it comes to infection prevention control. So when we think about our theme for this year, it's about talking about IPC champions. How about you, sir? What is your IPC champion move?
Well, maybe being an IPC or being a high lead, no, healthcare associated infection lead, IPC nurse, maybe my duty, no, as I've said, high lead, is to at least maintain because as CDC guidelines, we have to maintain at least 1 or below 1%.
Yes.
And
the
below.
guideline of our Department
Yes.
of Health. Less than 1% healthcare associated. And we are very proud that we always maintain the less than 1% high each month, and also for the annual high.
And how about you, JM? What is your IPC move?
Well, for me, being a training and education coordinator, for me, I believe my IPC champion move is health promotion. I think it's very important that we educate not just our healthcare worker but also our folks and patients when it comes about infection prevention, because as what I have also learned from my mentor, Dr. Joan Serrada, IPC is not just the role of the IPC team or the unit, but it's everybody's responsibility. And talking about Dr. Joan Serrada has been our chairperson since the start.
Yeah, since start. I think that was 2008.
Yeah.
Where when the IPC started, and
were you already here?
No. I started last I think 2014, as far as I remember. That was July of 2014, and during that time, I was not really looking forward
to being an IPC.
To be IPC because I have to explain myself. Because during that time, I am not really into documents, making reports and all of that. I'm not a techie person. That's why I don't see myself
more
working
on the bedside.
Yeah, I am more because I have so many experiences when it comes to wards, so I am so comfortable with that. But with regards to offices or like office works, no. But I feel like I was able to cope
and
love the infection prevention and control,
because it's already 2025 and you're still here.
Yeah, that is true. And I feel like I gained so much knowledge and skills where before, I don't really I feel like before I cannot really do the Excel thing, the doing those stuff, but
Reports.
at least somehow now I can. Yeah.
Yes, and going back, talking about Dr. Joanne Serrada, she is now our medical center chief, and she has a very special message to everyone regarding our celebration currently, which is the National Infection Prevention and Control Week. Let's go ahead and hear from our medical center chief.
Good day, everyone. This marks a very special occasion here in Corazon Locsin Montelibano Memorial Regional Hospital as we proudly celebrate the National Infection Prevention and Control Week. This year, our theme resonates deeply with the core of our mission, IPC champions, leading the way to safer healthcare. Infection Prevention and Control, or IPC, might sound like a technical term, but actually, at its heart, it is about safeguarding lives. It is the invisible shield that protects our patients from harm, ensures the well-being of our healthcare heroes, and upholds the trust placed in us by every person in the community that we serve. Every single day, we face threats that, if not managed effectively, can undermine all our efforts to heal and restore health. This is why IPC is not just a committee. It is the bedrock of quality healthcare. The theme IPC Champions Leading the Way truly captures the essence of what we aspire to be. It's easy to think of IPC as solely the responsibility of our infection control team. And indeed, they are the vital experts that are guiding us. However, being an IPC champion extends far beyond a specific role. It is a mindset, it is a commitment. It is the recognition that every single one of us, regardless of our position, plays a critical role in preventing the spread of infections and, more importantly, in leading by example. What does it mean to be an IPC champion and to lead the way? It means consistently practicing proper hand hygiene, the simplest yet most powerful tool we can possess, and encouraging others to do the same as we do the modeling for them. It means adhering strictly to isolation precautions when necessary and educating colleagues on their importance. It means ensuring our equipment is properly sterilized and our environment is meticulously cleaned, setting a standard for others to follow. It means being vigilant, speaking up when something doesn't seem right, and continuously seeking to learn and improve our practices, inspiring a culture of continuous improvement. It means embracing culture where safety is paramount and where preventing infection is a shared responsibility, not an isolated task, and actively guiding others towards this shared goal. Here at CLMMRH, we are incredibly proud of the dedication and hard work that goes into our IPC efforts every day. But the most important asset we have is you, our people. Your commitment, your vigilance, and your willingness to go the extra mile make all the difference, and your leadership inspires us all. As we celebrate this week, I urge each of you to reflect on your role as an IPC champion and how you can lead the way in your daily actions. Let us empower one another to uphold the highest standards of infection prevention and control. Let us continue to foster an environment where every action contributes to a safer, healthier future for everyone who walks through our doors. Happy National Infection Prevention and Control Week, everyone. Enjoy!
Thank you so much, Doctor, for that very wonderful and inspirational message. Inspiration talaga namin si Doc Serada.
Yes, always. Ever since.
Ever since. She's not just our leader, but she's our mentor and
An inspirational mentor.
support. Actually, when it comes to IPC, it would not be a success without the support of your lead or your mentor or your administration. That's one thing that would make the IPC work in an institution. And we do take that message from Dr. Serada that, again, it is everyone's responsibility, the infection prevention and control. It would not work pag kami lang yung nag-work but hindi naman kino-comply ng mga personnel. So, I'm also proud of our institution kasi I can say that we are very good when it comes to infection prevention and control. That's why we do minimize our healthcare associated infections as well as any outbreaks in our facility.
That is true. Now, let's hear from Miss Cheryl Impiales. She is also one of our infection prevention and control nurse. She is now touring around Corazon Locsin grounds to ask some of our personnel on their IPC champion news.
Mayong adlaw sa tanan. This week, we will be celebrating the National Infection Prevention and Control Week with the theme IPC Champion, Leading the Way to Safer Healthcare. Today, we will be asking around Corazon Locsin Montelibano Memorial Regional Hospital's personnel about their IPC champion moves in maintaining safer environment. Good morning, sir. What is your IPC champion move?
SJ Sabolbura from the Security Department implement no face mask, no entry inside the hospital.
Thank you. What is your IPC champion move in maintaining a safer healthcare environment?
Good afternoon, everyone. I am Miss June Hachero, a clinical instructor from University of St. LaSalle. So my champion move in IPC would be number 1 is hand washing in prior and after patient care. Next to that is we use the personal protective equipment in dealing with the patients. And lastly, would be doing the alcohol rubs in between if we could not do hand washing. Thank you.
Thank you, ma'am. So we would like to ask, what is your infection prevention and control champion move in maintaining safer healthcare environment?
In order to maintain proper infection control procedures in our workplace, we have to implement the policies given by the Infection Control Committee. We have to adhere to the rules and regulations of the hospital, and we have to make sure that our staff follows the implemented guidelines, and we have to check also the working environment if our staff adheres to infection control policies of the hospital.
Thank you, ma'am. Hi, ma'am. My name is Cheryl Impiales from Infection Prevention and Control Team, and we would like to ask you, what is your infection prevention and control champion move in maintaining a safer healthcare environment?
Hello, I'm Ayana Claire Asabiliana from USLS College of Medicine clinical clerk. For me, to prevent the transmission of disease, I practice hand washing, and also I report if I have symptoms and do self-isolation, and also I practice etiquette.
Thank you so much, ma'am.
Thank you.
We would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
I am Isa Velasco and I am an ICO staff. My IPC champion move is proper waste segregation. Thank you.
Thank you, ma'am. We would like to ask you, what is your infection prevention and control champion moves in maintaining a safer healthcare environment?
Hello, this is Pinky from Pharmacy by judicial use and dispensing of antibiotics. That's all.
Thank you, ma'am. And we would like to ask you, what is your infection prevention and control champion move in maintaining a safer healthcare environment?
Hi, I'm Gabriel Brian Pesca, a nurse 2 in the emergency room. So in the emergency room, it is important for the proper triaging of the patients who are coming in and out of the emergency room, and as well as the proper immediate isolation of the category 1 and 2 infectious diseases.
Thank you, sir.
Thank you.
Hi, ma'am. My name is Cheryl Impiales from Infection Prevention and Control Team, and we would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
Yes, good morning. I am Regina Cabatin Icogo from Bacteriology Section. For me, reporting of culture results every day.
Thank you, ma'am. From Infection Prevention and Control Team, and we would like to ask you, what is your infection prevention and control champion moves in maintaining a safer healthcare environment?
Hello, good day. I am Dr. Arcolas from the Public Health Unit. So as one of our core functions here in public health, so we initiate activities that could increase health literacy, not just among our employees and workers here, but as well as to our patients and their caregivers. So I think that's one of our best initiatives here in PHU.
Thank you, Doc. I would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
Yes, good afternoon. I'm Mrs. Eileen Esnerid, the head of the Nutrition and Dietetics Department. So one of our moves for being the ICC champion is we are using the color-coded chopping board, and we have a color-coded apron for our cooks so that we will know that they are always, every day they are changing their apron. Then we have a weekly pest control every Friday, and every after shift in the afternoon, especially on the night, we are flushing hot water aside from our pest control. We are observing the color-coded waste bin. That's all.
Thank you, ma'am. What is your IPC champion move in maintaining a safer healthcare environment?
Number 1, proper sterilization process. And of course, I'll make sure that all my staff here do proper hand washing.
Thank you, ma'am.
You're welcome.
What is your IPC champion move in maintaining a safer healthcare environment?
Hi, I am Lisa Tuba. I think it's our way. I always practice the protocol of ICC.
Thank you, ma'am.
Welcome.
Hello, ma'am. My name is Cheryl Impiales from Infection Prevention and Control Team, and we would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
Good afternoon. My name is Lois, a representative of Linen and Laundry. Soaking of dirty linen in the right ratio of a solution.
Thank you, ma'am. What is your IPC champion move in maintaining a safer healthcare environment?
Hello, good afternoon. I am Mika Aguila from the Pulmonary Department, and my IPC champion move to maintaining a safer healthcare environment would be, since I'm part of the Pulmonary Department, as I've said a while ago, would be merely just doing our job properly and correctly, and that would be our maintaining our the cleaning and the proper management of our mechanical ventilators. So I think by doing that alone, that's already huge contribution to the healthcare environment.
Thank you, ma'am. Yes, from Infection Prevention and Control Team, and we would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
Hi, good afternoon. The things that we do here. Oh, by the way, before I forget, I'm Vicente Galona and I'm from HD, unit of CLMMRH. And the things we do here to prevent infection is, of course, the standard for maintaining the aseptic technique of starting the HD patient and as well as dressing their IJ catheter. It includes obviously the aseptic technique and dressing and scrubbing the hub for 60 seconds to ensure that there will be no infection that's going to affect the patient. That's it.
Thank you, sir. What is your IPC champion move in maintaining a safer healthcare environment?
IPC's champion move. IPC best move to maintain safer environment in our unit is to always maintaining clean environment by doing the 6S, and then always do hand washing in before and after the procedure for a patient, and also making sure that we adhere to the rules and regulation that the IPCT TM provides in every unit. That's all. Thank you.
Thank you, ma'am. What is your IPC champion move in maintaining a safer healthcare environment?
I-maintain yung nung cleanliness sa kapaligiran ng pag-disinfect ng ating bed para hindi para yung yung pasyente na para yung pasyente hindi mawaan ng sakit na makalalata.
Thank you, sir. And by the way, what's your name?
My name is Roel Victoriano from Housekeeping Section.
Thank you. Hi, sir. My name is Cheryl Impiales from Infection Prevention and Control Team, and I would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
Hi, ma'am. Good afternoon. My name is Joshua Chongson ng panatili malinis ang buong ospital at disinfect ang buong ospital.
Thank you, sir. Hello, Doc. My name is Cheryl Impiales from Infection Prevention and Control Team, and I would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
Hi, good afternoon. I'm Dr. Jamila Kathleen Basomo, a first-year resident from OB-GYN department. So my champion move is to maintain sterility in the OR, especially like practicing proper hand washing, and this is to avoid SSIs and to provide bundles of care. Thank you.
Thank you, Doc.
Thank you.
Let's go. Let's go, guys. Let's ask the CT scan staff regarding their IPC champion move in maintaining a safer healthcare environment. Infection Prevention and Control Team, and I would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
So I'm Lydia Centubelleja. I'm from Didiers, Radtech 4. And maintaining is first is hand hygiene and of course cleanliness or disinfecting every other patients.
Thank you, sir. Hi, ma'am. My name is Cheryl Limpiales from Infection Prevention and Control Team, and I would like to ask you, what is your IPC champion move in maintaining a safer healthcare environment?
For the part of the engineering, we always make sure that the ICC is always coordinated with all of our designs for the structures to assure the safety of the patients and the health workers.
Thank you, ma'am. By the way, what's your name?
Joanne Binias.
Thank you, Ma'am Joanne.
Thank you.
Hello, sir. My name is Cheryl Limpiales from Infection Prevention and Control Team, and we would like to ask you, what is your IPC champion move in maintaining a safe healthcare environment?
Ooh, that's a tough question. Well, first, my name is John Rochelle Dialayan from Hospital Epidemiology Surveillance Unit here at Corazon Locsin, Montelibano Memorial Regional Hospital. Well, I think my IPC move will be this one.
Kidding aside.
Just kidding aside, Mo. Well, for me, as a HASU nurse, I think the IPC move that we have here in our unit is prompt reporting of our notifiable diseases weekly and monthly to be forwarded to our MCC and to other department, as well as to the national agencies, to the province and region. And after, we have to be proper handling of collected specimen to be forwarded at the RITM in Iloilo. And because we are one of the sentinel sites of rotavirus here in the Philippines, I think that's it.
Thank you, sir.
Bye-bye.
Wow, grabe yung pinuntahan ni Miss Cheryl just to ask their IPC champion moves.
Ay, dami. Ang dami nila actually. But we are really happy no na some of them do have that IPC champions, not just again as Miss JM said earlier, no, the IPC or the Infection Prevention and Control is not just our responsibility. It is the whole Corazon Locsin, no, kahit nasa admin ka, no,
Yeah.
IPC is still there, no, every single day of our life.
Kahit si Sir Security, si Manong,
Yeah,
si
true.
Manong,
Si housekeeping,
housekeeping, and also our dietary. So IPC, it's all over the hospital talaga. And I'm so happy that everyone do have their own IPC champion moves, and we do hope that you would still continue to comply with it and live it with your heart. Kumbaga.
Now,
And right now,
well,
we heard already the champion moves from all over the hospital. And now,
we are moving now to a message from our current Infection Prevention and Control Chairperson, Dr. Ika Caperonce. Well, I think she started last 2023, right? Am I right?
Yes.
2023. And, well, aside from her being pretty,
yeah, very
well,
pretty.
that is...
parang kung IPC ka, dapat pretty ka.
Talaga ba?
Oo.
Tama naman.
Oo, tama.
Correct.
Oo.
Pretty?
Yes.
Alright. Hindi lang naman yan. So, well, Dr. Sharada is inspirational, as well as Dr. Caperonce. No? She inspires us also with her knowledge, no? When it comes to infection prevention and control, and it really helped us, no, to be our best, not just parang alam mo yun, parang okay lang, parang ganun. But it's not that, no? And also,
we actually have a lot of achievements already for this year because of Dr. Ika, of her sharing of knowledge and mga ideas niya.
yes, ideas. Yun
Yes.
yung ideas niya.
So, we're thankful that we have Dr. Ika as our ICC chairperson. And right now, we are going also to hear a message from her celebrating our National IPC Week.
Hi, Doc. Can you please introduce yourself?
Hello, everyone. My name is Dr. Erica Joanna Caperonce, and I'm currently the Infection Prevention Chair of CLMMRH IPCU. I joined the institution late 2023, but I'm very lucky to be part of a very competent and very proactive team.
Please tell us your journey as an infectious disease specialist here in CLMMRH.
I first became interested in the field of infectious diseases when I came across a very, very young patient at the emergency room who, despite being very young, was actually very, very sick and at the brink of death. So the patient was eventually diagnosed with HIV, and it was at that time that a lot of young people were actually dying of such a very controllable and manageable disease if caught early. So it was then that I discovered that I could have a bigger role in infectious diseases, especially in advocating for PLHIVs. My journey in CLMMRH as an IDS consultant has been very fruitful because I've been given an opportunity to really help a lot of patients from all walks of life, and we see a lot of infectious disease cases indeed. So I believe that being part of the CLMMRH IDS family has really given me good reach and a good opportunity to help more people in the region.
What is the most impactful event as an IDS that you experienced?
So not just as an IDS per se, I would say as someone who practices infection and prevention and control, it was really during the pandemic because I was training in an institution with very good nurses, very good specialists and physicians. But since the pandemic was very new and we were faced with an entirely new threat, I really realized that even very good doctors and very good nurses can be frozen when faced with something that they are not aware of. And it was then that I saw the strength of our IPCC then, with all the protocols that they immediately put into effect. They were able to immediately strengthen and empower the staff to face the COVID-19 pandemic. It was then I realized that infection prevention and control is actually far-reaching than what it seems. You're actually able to help more people than just one patient. So for me, being an infection preventionist really gives you the opportunity to help more.
So can you please share us some of the challenges infection prevention and control?
Of course, you will always be seen as the police. You will always encounter resistance to change, especially when it involves uncomfortable situations for other people. It's also quite costly to impose IPC protocols. But however, we always have to push forward because at the end of the day, you actually save money and protect patients if you prevent infections from happening to begin with.
And last but not the least, can you show us your IPC champion move?
My championship move? My IPC championship move is that I always update my vaccines because prevention is always better than cure and getting a disease. I protect my patients because I get vaccinated myself. That's one move. My second move would be, I would say that my second IPC move would be, I never skip the proper doffing sequence when I'm wearing complete PPE because it is really the essential step in ensuring that I do not get any infection.
Thank you so much, Doc. Healthcare workers in maintaining safe healthcare. Can you please share us some of the messages or one message that you can share with our healthcare workers in maintaining healthcare or safe healthcare environment?
Remember that even if you are just one individual, your actions really matter to your patients and to the whole hospital. So even if you feel that your IPC effort is very small, it actually isn't. So if you are a champion, you advocate not just for this hospital, but for all of the patients here. So do not be discouraged in pushing through with strict IPC protocols, because I promise you, your efforts will go a long way. Happy IPC week.
Thank you so much, Dr. Ika. Her full name is Dr. Erica Joanna Caperonce, but we do call her Dr. Ika. But she's our Beanie Ika.
It's Beanie. Sure.
Yeah, she's like a beanie to us. She's very pretty, guys. I'm sure everyone would agree. But aside from her being pretty, she's actually very brainy.
Brainy, yes, like you.
Yeah, yes. But we really did receive the message from Dr. Ika that her IPC champion move is really to update your vaccine. It's a very great move that by updating your vaccine, you're not just protecting yourself, but you're also protecting your patient and the people around you as well. And another thing is that she's not skipping the donning and doffing sequence, which is very, very important to avoid contamination and transmission of disease. We do learn a lot from that message. And her message to our healthcare worker is that all your actions do matter to our patients. May it be simple. Hand hygiene, it really does matter to our patients.
That is true. Now, we have to end
Yes.
the live. So, again, thank you, everyone. And again, this is an infection prevention and control national event. And before we end, please follow our FB page. It's Infection Control Committee on Facebook. And we really hope that this inspires you in a way na, alam mo yung, kasi may mga iba na hindi naniniwala sa infection prevention. No? They are more on cure. I mean, especially those areas na medyo malayo. No? So, I hope this message instills in your head and in your heart also. Most especially in your heart. And this infection prevention and control upholds the highest standards, no? Of our everyday life. So
it is. And this not just only protect our patient, but we do foster a safe environment, not just in our institution, but in our community.
Yes.
So sad to say, we will have to end our Facebook Live, guys. If you want to share your story as well when it comes to infection prevention and control, your journey to IPC, do message us, let us know in the comment section below, and we will read all of it. Let's continue to celebrate the IPC week for the rest of the week. Happy
Infection Prevention and Control Week. Thank you, everyone.
Bye. Everyone.